Hello, everyone. Welcome. My name is Gary Parker. I'm the Associate Dean for External Affairs at the Brown School at Washington University in St. Louis, where I also have the great privilege of being the director of the Clark Fox Policy Institute. And welcome to the Brown School's three-part series, Supporting a Healthier Missouri. And this is part 3, Medicaid Expansion and Family Wellbeing. Research supports that expanding Medicaid coverage for adults increases the likelihood that eligible children will also be enrolled and that way they'll have access to preventative health care, such as well visits, and experience a continuity of care. And this panel will explore how Medicaid expansion could mean coverage for some 50,000 parents in Missouri and the implications for family well-being, workforce development, and breaking the cycle of poverty. And we want you to be a part of the conversation. Although we cannot see or hear you, we would love for you to send us your thoughts and your questions through the chat feature, and we will relay them to our panelists. Now, I mentioned that this was part 3, parts 1 and part 2. Part 1 was Medicaid expansion and racial equity, and part 2, Medicaid expansion in rural communities, are available online to watch, and I'll put a link in the chat section for those of you that are interested in viewing those first 2 parts. I also would like to invite you to participate in an upcoming program on Tuesday, August 4th at 12:30. That's Election Day, so right after you vote in the morning, you can join us in the afternoon for part 8 of our COVID-19 and Race series. This one will explore the high price of economic injustice. I'm going to also put a link in the chat feature where you can explore the previous 7 parts that explore issues ranging from the economic and health disparities in the Black, Latinx, and Native communities to how to talk to kids about race and social justice. And we also have a recording of a very special teen panel who speak candidly about their experiences with facing and fighting racism and injustice. I think that's something you'll really enjoy. So first, I'd like to welcome 2 speakers to give welcoming remarks. Let's please give a warm welcome to the Neidorf Family and Centene Corporation Dean of the Brown School, Dr. Mary McKay.
Thank you, Gary. Thank you, Janet. I just want to express my real gratitude for this series, for our speakers that are here today. What I think is so important about this series is that it's based on a set of real looking at data and really demonstrating the positive impact that Medicaid expansion can have in our communities. This particular conversation is really focused in on children and families, which is the background that I come from. I think about health as a family effort, and so what we can do to support families to have children be healthy, their adult caregivers be healthy. This is an important conversation. Opportunities to actually access health care, get preventative care, take advantage of a policy change. This is what we have in front of us. And so I'm incredibly grateful. Again, I wish I could hear our panelists live, but I will definitely hear you in the online recorder later today. So I thank you. I particularly want to acknowledge Cynthia Williams as we end. You have taken a driving role here in our community as Director of Community Partnerships, organizing our panels and being a really important voice that we understand that policy changes really are one of the doorways that we can use to dismantle structural racism, to open up new opportunities. And I'm incredibly grateful for you, Cynthia, Janet, Gary, and our panelists in this conversation. Also, Dean David Perlmutter, the collaboration with the School of Medicine is really important. Like any institution, we can be siloed on campuses and by the very busy kind of work and that happens within our schools. So I'm grateful that we could co-sponsor this series together. And David, you've played a real leading role in our discussion across the state of the importance of Medicaid expansion. And so please take it away with some welcoming remarks. Thank you all for being here.
Thanks, Mary, and my thanks to the Clark Fox Policy Institute and the Brown School of Social Work for setting up the series and playing a role in our overall initiative to work for this very important policy change. And I am, together with Dean McKay, I am representing the university, which doesn't always feel like it's in a position to take a stand about a policy, because we really are an educational institution and a provider of healthcare. But this is a policy that is so fundamentally important to our role within the community here in St. Louis and in the state of Missouri and in the Midwest. As Dean McKay mentioned, there's a lot of data now from the 38 states that have taken on Medicaid expansion. And that data is overwhelmingly positive with respect to improving access to healthcare, improving health outcomes, and improving economic security. Like Dean McKay, I actually am a pediatrician. I don't practice anymore because I have an overwhelming job. But as a pediatrician, I can speak to, when you're taking care of kids, you're really taking care of kids with their families. And if those families don't have a structure by which they can be a part of the healthcare that's needed, it ends up being an important component of what I would describe as the trauma, the family trauma. And we know from many, many studies now that an environment of trauma has very negative effects on health. I also want to make the point, you'll hear a lot more from the panelists, but I also want to make the point that we know from the experience in the 38 other states uniformly that in contrast to what you might hear over the next week as we get to voting, that this is going to cost the state money. In fact, it does not cost the state money because of the way the expansion works and because of the way that the current Medicaid is financed by the state. The state will be predicted to actually end up with additional resources because of the amount of money that comes from the federal government. So in addition to covering another 230,000 individuals, the state will end up, when it expands, with additional resources. And what I always say when I'm talking about this subject, just imagine if the state were to use those additional resources to invest in early education and how much we know about how early education improves health. I always get into this argument with my friends. Is it early education that improves health, or is it health that improves early education? And it's both, and they're inextricable from each other. So once again, thanks to the Clark Fox Institute, to the Brown School, to our university, which is playing a role in leading in this effort, and to all of you. Let's get out there and vote on Tuesday. Let's get everybody we know out there to vote on Tuesday, because we know that the more people that vote, the more likely it is that we'll pass this important policy change. So thanks again, and I look forward to hearing from the panel.
Thank you so much, Dean Perlmutter. Really appreciate those words. And yes, you're absolutely right. We need to encourage folks to get out and vote on August 4th. I also want to add my voice to the many thanks that are going to Janet Gill, our Director of Professional Development and Executive Producer of the Open Classroom Initiative, and also a special shout out and thanks to Tia Thurman, who is the Associate Director of the Clark Fox Policy Institute and a mastermind behind the scenes. And now I'd like to welcome my co-host and my friend. She's a mastermind behind the scenes, and she's now a mastermind in front of the scenes. So please give a warm welcome to Cynthia Williams, Assistant Dean for Community Partnerships. Hi, Cynthia.
Hi, Gary. Me and this mute. Good afternoon. Again, my name is Cynthia Williams. I am so honored to be here this afternoon with this esteemed panel. Thanks to Dean McKay and Perlmutter so much for your opening And I'm very, very eager to get into introductions for our panelists and go into the questions that we hope that will frame a very fruitful discussion. So at this time, I'm going to start with you, Brian, and ask you, please, to introduce yourself, your organization affiliation, and your current roles or whatever hats you're wearing these days in the region.
Yeah, sure. And thanks so much. I really appreciate the opportunity to join everyone today. My name is Brian Schmidt. I'm the Executive Director of Kids Win Missouri. We are a multi-issue policy and advocacy organization that advances policies that support the well-being of children and families. And kind of through that role, I also serve on the board and help lead the policy work for the Show Me School-Based Health Alliance. And the Alliance is also very supportive of Medicaid expansion too.
Thank you. Melissa, please.
Good afternoon, everyone. My name is Melissa Chambers. I'm the Vice President of Early Learning Programs for Youth in Need.
Miranda and then Lora, thank you.
Good afternoon, everyone. I'm Miranda Jones. I am the Interim COO for Better Family Life, as well as the Vice President of Youth and Family Services for the organization. In the community, I also play a hat of a school board director for the Jennings School District, as well as the councilwoman for the city of Jennings. And one more really important hat is that I'm a mom life, right? So I bought my hat, and it's just important as a mom to be a part of this discussion as well.
And good afternoon, everyone. My name is Lora Gulley. I am the Director of Community Mobilization and Advocacy with Generate Health. And our role in the community is really focused on improving the health of moms and babies, but doing it with a racial equity lens. So looking at ways that we can improve birth outcomes by addressing root causes of racial disparity. So glad to be here.
Thank you so much. I'm going to go into our very first question, just to level set, and ask you, Brian, to respond about why is Medicaid an important mechanism to ensure that all Missourians can achieve health and well-being?
Yeah, sure. So I think Medicaid expansion, the most important thing is that it provides health coverage to folks that may not currently be able to access it. And so they're able to, through that, access preventative care and health care treatment. And, you know, it also helps support access to care too, because a lot of, we know that Missouri's 10 hospitals have closed in Missouri's rural counties. And a lot of that is because Missouri has not implemented Medicaid expansion. And we know that our health providers are stronger and can provide services in a more accessible way if Medicaid expansion is available. And, you know, just another point is that it's also just impacts families' finances. When families have to choose between going and visiting a doctor or a healthcare provider and paying their bills, that's just not a good position to be in. And so I think that it's just eliminates one concern for families and helps make them more financially secure.
Thank you. Melissa, would you like to respond, and then we'll open it up to the rest of the panel?
I absolutely agree with everything Brian just said. And I think in my daily work with children and families, we see that decision-making process happening every day of having to choose on how they use their financial resources. So the expansion of Medicaid and taking that off of that plate is really a life changer for a lot of our children and our families, where they no longer have to choose to be healthy and to take care of their health versus paying for their rent or their food or their child care. I also think about how important we know that parents or caregivers are in the lives of children. And when we think about our future and wanting children to be healthy and educated, that starts with the adults in their life. And with the families that I see every day, a lot of the children are covered and have health care through Medicaid, but the parents do not. And so that is a significant gap that I am hopeful would be addressed through this expansion.
Thank you. I'm going to move to Miranda and Lora with this question. Children under 6 that are uninsured are certainly at risk of missing routine screenings and immunizations. So will you both address how will Medicaid expansion change the health trajectory for Missouri's children?
I guess I'll go ahead and start. This is, as was said before, this is fundamentally important. When you talk about missing immunizations and screenings for a child that is going to start kindergarten that may have a hearing impairment, but that we don't catch it early, they go to school, language development is hampered, all those things. This is a cycle that you want to try to break early, and catching these things and intervening early gives us the opportunity to do that. When you have children under 6 that do not have healthcare and parents are struggling with other things, for them to be able to get those routine things is so, so important. I think it changes the trajectory immediately when you are able to pre-screen, have them ready for kindergarten, have them ready for pre-K, because we know how important that is. We talked earlier about what's more important, pre-K, in education or being healthy, and it's a cycle. You can't learn well and do well in school if you don't have good health care and you don't have, you're not healthy. And, if you're not healthy and you don't have what you need to be in school, then you're not in school. So it's a cycle that has to flow together.
And I would just add, really adding on to what Miranda shared, was that this allows not just children, but families to have access to ongoing, unbroken quality care that we know is fundamental for having real positive health outcomes, particularly for pregnant women. If we extend that continuum, those children will grow up, and we want them to be as healthy as possible. So being able to have that continuum of coverage allows families to have access to those preventative and maintenance kinds of care that we know is going to improve their outcomes.
Thank you. I'm going to move to you, Gary.
Sorry, I've been playing mute, unmute with all of you. So we're back. We would love to hear from our panelists, and thank you so much for sharing some of the important positive outcomes that are going to happen with children. But what are some of the unique challenges that you've faced in your role that Medicaid expansion would improve or ameliorate?
Working with children every day, we see children that need, for instance, asthma medication. They can't get their medication because they don't have insurance, and parents are struggling with trying to figure out how to get them what they need. So, just if you're working with children that are in school districts or in my after school programs or what have you, every day you're running into children that need services that are not able to get them because parents don't have the means. And sometimes they know in an emergency situation, I have one child that had to go to the emergency room for asthma, and the parent, the bill that comes after that now affects their credit, which now affects their ability to get a car or the house that they need because of these bills that are mounting because of not having the coverage that they need. There's a short-term effect of kids not going. When it's an emergency, they go, and then the long-term effect is that these bills that are affecting credit and the ability for parents to move out of their current position and move on and to do better and greater things. So again, it's always about these cycles and trying to break the cycles. And it just starts with something so simple as having children, have the ability to get the health care that they need.
Mm-hmm.
And I would add, right now, people can't enroll in Medicaid until they're pregnant. So that delay of seeking care or going into a pregnancy being healthy certainly impacts the outcomes that we're trying to improve. And some of the other areas that we hear all the time is that families are delaying putting off addressing some of the chronic illnesses like hypertension and other kind of cardiac cares or diabetes for that matter, that if we can get, under control on the front end, that we're more likely to have positive outcomes for both children and families.
Thank you so
Gary,
much.
I'd also add, sorry to jump in, just to add on, I would also say, one of my hopes is that access would increase. We serve families both here in the urban core and also in some of the surrounding rural counties where there just isn't any medical care available and they're having to drive long ways to get that care. And so, as I think Brian spoke to earlier, the hope that this expansion would help to shore up some of the availability of medical services in some of our outlying communities would be very impactful on children and families' lives.
Yeah, and one of the things that kind of we've been focused on too is just the fact that states that have not expanded Medicaid have seen increases of in the rate of their uninsured children that are 3 times as large as states that have expanded Medicaid. And so we know that, especially in the past couple years, Missouri's, we've seen a lot of kids that have lost their health coverage. And so we see Medicaid expansion as a way to help ensure that kids are covered, because if parents are covered, then kids are more likely to be covered too.
So just a follow-up question to that, Brian. We have seen a kind of dramatic drop in the number of kids that are covered. Can you talk about why that's happening?
Yeah, so this kind of goes back to when states are required to do an annual kind of checkup to determine whether or not families are still eligible for their kids to receive health coverage. And Missouri hadn't gone through that process for a number of years. And so they kind of flipped the switch and turned that certification process on a little bit over, I think it was about 2 years ago now. And when they did that, they didn't have a lot of addresses for up-to-date addresses on folks, and folks didn't know that they had to fill out a form and send it back in. There was a lot of issues with call centers being overloaded and folks trying to call and give the state their information to show that they're still eligible. And so there's a lot of administrative gaps that kind of contributed to kids losing health coverage.
Miranda, can I ask you a question about this too? Do you think that some of these kind of like administrative hurdles are there just because of poor administration, or do you think it was the intent of the design to have these kids off of the Medicaid?
Ooh, that was a loaded question.
We asked the hard ones here.
No, I mean, I would not want to say that it was the intent, but surely there seems to be something that is clogging the wheels here, and that we know that being one of what 12 states left that have not expanded Medicaid makes it really difficult for our children and for the things that are happening. There's a lot of clogs right now in the way that our state is turning, and again, you can see them manifest themselves in a lot of different areas. So again, I don't want to say that it's an intent, but it surely doesn't look like we are making it easy, and we're making it more accessible, and that we're giving a clean lane for people to be able to get the health care that they need. So I think that we definitely we have to be able to make get our clients and our students and our families to not just to have it there available for them, but get them to the point where they can actually get the services that they need. And if you make it so unattainable that they can't even get those services, and then we have so many families that are falling in the gaps, right? They make, you know, just a little bit too much to get the services that we currently have and not enough to get the private insurance and the you know, the affordable care, the different things, the discounts that they have right now. So they're right there in the gaps, and we, you know, being able to expand it would get people right out of that gap and get them into a place where they would actually be able to get those services.
I know we're talking specifically about Medicaid expansion, but I would love to hear from the panel what types of policy changes could be implemented that would make it much easier for kids to be enrolled.
I mean, I think one of it is just 12 months continuous coverage, where if they sign up, they're guaranteed coverage for a year. Right now, you know, if there's a change in the family income, then they could lose their health coverage. And then the other thing is just express lane eligibility, where if a family qualifies for SNAP, which helps provide nourishment, nutrition for families, then that if they meet the income qualifications and other guidelines of the program, they would automatically qualify for health coverage. It's just to make it really streamlined and easy for families.
We have a question from the chat. Brian, I'm going to direct it to you, if I may. The chat is asking, will this expansion provide mental health coverage for couples, family, and therapy, as well as individuals?
You know, that's not something that I'm super familiar with. So I don't know off the top of my head. I believe it does cover mental health services, but I don't know what types of services it would cover.
Okay, thank you. The follow-up question too, we often get the question and the information about a possibility of 16,000 jobs being created because of Medicaid expansion, with a promise of $15 to $16 an hour. Do you know what type of jobs that might be?
I mean, I think a lot of the jobs would probably be in the healthcare sector. Mm-hmm. And it's doctors and nurses and other folks that provide critical healthcare services. And then, but I also think that there's that economic activity, and you know, Medicaid expansion would bring $1 billion to Missouri and all that economic activity results in jobs that not only in the healthcare sector, but other sectors as well. So I think it'd be a shot in the arm for Missouri's economy.
In addition to that, in the private sector, I'm also hearing that there will be some benefits to the incarcerated individuals, where there will be additional services provided for them. Is that something that you've heard as well?
It's not something that I'm extremely familiar with. So if one of the other panelists has information on that, I may not be the best person to answer that.
Thank you.
I'm not sure about incarcerated, but I did, you know, just to follow up on the jobs, you know, we talked about all the hospitals that are being closed in some of the rural areas, and being able to have that expanded services would allow for some of those hospitals, I'm sure, to remain open in those healthcare sectors, as well as the case management and getting, you know, the clients that organizations have. I'm sure there's going to be some jobs in terms of helping to process those, the expanded services.
Thank you. So I'm going to direct this question to the panel, but I'll start with you, Miranda, and then ask the rest of the panelists to respond. How have you seen that COVID-19 has, let me rephrase, how has COVID-19 impressed upon you the importance of the expansion of Medicaid?
COVID-19 is truly the tale of the have and the have-nots. It has shown clearly the disparities in healthcare, especially now with COVID-19 hitting a younger demographic. I think that it's going to be so much more important now when we talk about Medicaid expansion and we're talking about younger kids not having insurance with COVID-19, them being tested, them being treated. I think COVID-19 is for us, illuminates what people have known for years about the disparities in the urban sectors, and really rural areas have not seen it as much, the COVID-19 emergency, but they are seeing it now as it starts to expand into Wentzville and it's expanding into Jefferson County. And so, again, COVID-19 has really shed some light, and it's caused us to not have a new normal, but a better normal going forward, and a better future, hopefully, that we can see that people are now, cannot no longer turn a blind eye to the healthcare disparities that are going on with people of color and people who are below the poverty line.
I also think that COVID-19 is it levels the playing field. It allows all of us to see not only the disparities, but because it crosses all boundaries, that allows people to understand the plight of others and what they may have experienced previously that they could not maybe relate to. So this then allows for from the social economic stratosphere, the geographic stratosphere, for us all to be in this together, because we truly are in this together. So I do believe that that's what COVID really allowed us insight into, is those that are most impacted and the plight that they experience, so that we all now truly understand.
It is this interesting result of really the failure of our healthcare system to be able to respond to an emergency like this and a pandemic like this that has, I think, if anything, kind of really allowed folks to say, wait a second, we need to take another look at this because I could be next, and I want to follow up something because Miranda, you made a really interesting point, and in our chat here, Katrina made a comment as well, and she's a social worker, and she says her clients have also had to deal with garnishments by debt collection lawyers who are hired by Children's Hospital and doctors to garnish the parents' wages for past bills when the parents had to take the child to the hospital. And these are struggling parents who do not fall below the poverty line threshold. So can we talk about Medicaid expansion as a kind of anti-poverty tool to prevent this kind of debt collection for parents that are not just those parents that are below the poverty line, but those parents who are just above it, who could at any second fall into the grips of poverty? I'd love to hear the panelists' thoughts on this.
Yeah, I think, I'm sorry, go ahead.
Sorry, Brian. I was just going to say I would jump in first. We absolutely see that happening all the time, just as Miranda described it. When families have to make that choice, and oftentimes it's gone on and on and on and on because they didn't have the initial resource. And then they're going to the hospital emergency room where the cost is greater. And that long-term impact and the debt that Miranda spoke to earlier, that's a daily occurrence. And it is so unfortunate when there are other options available. But so many of our families don't have the access or the resources because of a lack of insurance.
There's a question in the chat I'd like to follow up with. This question is about coverage for new moms, and it had been covered a little bit, but the question is based on 60 days after birth. New moms lose Medicaid coverage after 60 days. So do you think Medicaid expansion will improve upon that or extend coverage for new moms post 60 days after birth?
Yeah, I'd like to address that. There was, I believe 2 years ago, we passed Medicaid expansion for pregnant women that had experienced substance use or and mental illness. And it was a targeted population that our legislative body was that received bipartisan support for because of the rise of the opioid epidemic. And so we actually were one of 3 to 4 states that expanded a slice of our population for Medicaid. We're still tied up in the with the Centers for Medicaid CMS. I can't think of what it actually stands for, but we're still walking through the implications of that and getting that to actually be implemented. So yes, in essence, this would really oversee and allow us to, women to receive that expanded coverage, which we know is so vital, not just the 9 months that a woman is pregnant, but even postpartum and in between pregnancies that can catch some of those and address some of those chronic illnesses.
Thank you. There's another question in the chat. Gary, do you see the question? I kind of lost it. It's about, here it is. There's a concern that Medicaid expansion will ultimately bankrupt the Missouri budget because of the families who have been affected by long-term unemployment. So can you speak to how this Medicaid expansion in brief will affect the budget?
Yeah, so, I think there have been a number of peer-reviewed studies that have examined how Medicaid expansion has impacted the other states' finances, and no other state has had to raise taxes, and no other, and very often, and I think even with a study that was done by Dr. McBride from Washington University, showed that Medicaid expansion was going to result in additional in savings for the state and additional revenues for other services like education, pre-K, and other supports for families. And so I think there's a lot of, there are 38 other states that have done this, and there's a roadmap for how to do this. And I think that ultimately, I think we'll take in a lot of more federal revenue, and it's going to free up state revenue for other services.
Brian, I'd like to just add, we're spending money on higher costs for health care, even for those that they're not getting the preventative care. So we're seeing more chronic illnesses that we're paying for anyway. And so thinking, and then we're not able to draw down the federal dollars that could assist our state in supporting covering some of those costs. So whether we want to pay for it on the front end or the back end, we're still paying for it.
That's exactly right.
As well as we talked earlier about the job development and the economic boost that comes along with Medicaid expansion, the hospitals that could remain open, and those people that may not have to get unemployment as a result of being able to be employed because you have more people being able to access the services. So I think that, there's a misconception that this is going to bankrupt or cost the state more. And when in fact it's going to cost us less in the long run and make us an overall healthier state and more productive state overall.
Thank you so much for that. So I have the great privilege and honor of serving on the board of directors for Ford through Ferguson. So I would be remiss if I didn't ask this question. How does Medicaid expansion advance racial equity for the kids of Missouri? And that's for anyone who wants to jump in.
Medicaid expansion is a step towards racial justice. It breaks down the barriers to care that have been long-standing, that we can look at any given kind of health rate and statistic and look at the disparities that we have across our state. For the region of St. Louis, we have, you know, Black women experiencing high rates of maternal mortality that are 2.5, 3 times that of their white peers. We have Black babies that are dying 2.5 to 3 times more than that of their white peers. So we have disparities that Medicaid expansion will allow greater access. And if we're talking about addressing some of those preventative chronic illnesses, can go towards improving better outcomes.
I think that, you know, this is something that we all really, it's a very obvious thing and we're very passionate about it. And when you look at the states that have not expanded, it goes right along that Mason-Dixon line. And, you know, we want to be on the right side of the line this time. I think that it's important. This is a historical issue that we have to deal with in Missouri. And it definitely brings us closer to having better racial equity in this state.
Well, and thank you for those comments. You know, the Ferguson Commission and Ford through Ferguson have defined racial equity as when outcomes can no longer be predicted by race. And I think one of the things that we keep talking about is access. And with greater access to healthcare, you know, hopefully these disparities within communities of color will diminish because there will be an increased amount of access, and therefore health outcomes will no longer be predicted by race.
Thank you. I have a question that I will bring forward, and that's about how, speaking when, I'm going to be positive, when Medicaid is expanded on August the 4th, we vote for that expansion. How will Medicaid expansion open the door for a broader, more diverse coalition of people across Missouri to work together? What do you see our future looking like?
I think there's a couple things. There's like I mentioned my work with the Show Me School-Based Health Alliance, and you know, the Alliance is really excited about the opportunities for Medicaid expansion because Medicaid expansion helps support providing access to health services for communities. I think there's a lot of collaborations that could happen in that way. And then, but I also think, you know, looking at it from like an advocacy lens, which is the bulk of my work, you know, we're working with hundreds of organizations across Missouri, and you know, we will on the implementation of Medicaid expansion, and we're working to get it across the finish line now. And that coalition includes philanthropy, health providers, doctors, nurses, chambers of commerce, education groups, and many more. And it's been a unifying force in Missouri, and I think it'll continue to bring a diverse group of stakeholders together as it's implemented in the near and distant future.
There's a question in the chat that people are concerned that over time, the federal share would decrease from 90% to where it is now without expansion. Can you respond to that, Brian?
You know, when it was Medicaid expansion, when it was initially passed in 2014 or first implemented, it started out as 100% reimbursement, and then it phased down to 90%. But it's been 90%, and I really don't see any activity or action around it dropping below 90%.
A follow-up question. Oh, go ahead, Miranda.
Cynthia, I wanted to comment on something you just asked a minute ago about collaborations and where we would go in the future. I think gives us an opportunity for, you know, when you have a policy institute like Washington University that's looking at policies, and we're looking at health, and we're looking at when this passes, that we can say that all of these people successfully came together with policies, with data, and with the power of the vote to make a change. And when we see those things happen, I think that that inspires us to look at other policies and to make other changes with the collaboration just with the people that are on this call, that inspires us to keep coming together to look at those things in terms of data, policy, and how we all come together to make the changes that need to be made.
Thank you.
Miranda, if I can, I think you're absolutely right. And we're seeing that in so many different ways, not only through the Medicaid expansion, but, and it's related, we're also seeing an incredible amount of activity around increasing access to early childhood education. And we have groups like the First Steps to Equity Collaborative that are really trying to address ways in which to increase public funding, to increase access to ECE, because it's not only being able to have access, as you were mentioning, you know, earlier in the talk, it's not only important to have access to healthcare coverage, but having access to quality, affordable early childhood education and care, particularly 0 to 5, helps identify and address health needs, any type of educational needs or development needs, social, emotional needs at the very beginning, that sets kids up for success. And I know many folks on this panel have been working very diligently on issues surrounding early childhood education. So I wanted to provide an opportunity for you to comment on that work. And I'm also going to start putting some links in the chat section for folks who are interested in learning more.
Yeah, so I'm sorry, go ahead.
Go ahead, Brian.
Yeah, well, you know, at Kids in Missouri, we've been focused on early childhood and early care and education for you know, a number of years now, and I think there's a lot of momentum around the issue in the St. Louis region, and we're excited about that momentum. And I think that, you know, it's just such a critical investment to the success of our region and our state. And so I just want to say that it's something that that we will continue to work with and support Ready by 5 and the First Steps to Equity Collaborative as the initiative moves forward.
Thank you. Is there another panelist who'd like to respond? Yes, Melissa.
I would just echo the sentiment of how very important it is. You know, I've been privileged for most of my early childhood career to be associated with Head Start and Early Head Start, which is a dedicated federal funding source. And through Youth in Need, you know, we serve over 1,500 kiddos who would not be able to afford quality early care and education services. And we know the need is so much greater. And not that Head Start and Early Head Start is the answer, because it's not. But I think the model and having that subsidized available funding, we've seen the impacts of that. And so I've been really privileged to be able to contribute with Ready by 5, and I'm so hopeful for the future as that group and hopefully that funding comes to fruition for the kiddos and the families in our region.
Thank you. We have a question in the chat that can you speak to about the political strategies that have been implemented and executed to address those concerns about individuals who have traditionally been less supportive of expansion of social services?
So I think one of the strategies that has been implemented is that this has been the where Amendment 2 is on August 4th. It was a grassroots initiative that over 300,000 people signed petitions to put that before voters. And they have that constitutional right to do that. And so I think that it's something that has a lot of support across the state. And I think that, you know, it's one of those things where, you know, the people are really unifying and moving something forward together. And I think that also sends a strong message to folks who may be hesitant about expanding social services.
I also think some of the strategies really are focused on the head, heart, and hands, which I like to say are really around understanding what the statistics are. We're looking at other states and what kind of demystifying some of the things that may create hesitancy for expanding Medicaid, and just looking at their numbers and looking at the economics behind what that means for that individual state. The heart, how many folks this would actually impact, and those that would be creating doors where there weren't opportunities before. So those personal stories, I've seen the commercials that are trying to help people connect with people that look like them and have similar experiences of them and why this is important to do. And then the hands, I think Brian spoke to, that this was a movement of the people that got out and got behind wanting to do this. Really, our legislative body did not. And the people, as Miranda spoke to, the coalition of diversity of folks got together to build the momentum for this support of Medicaid expansion.
And I also think it's about making it not an urban African-American issue. This is a statewide issue that is really affecting a lot of rural areas. And a lot of times we have a tendency to just think that, oh, this doesn't affect me. And we see that this is definitely affecting, and I've heard more and more about the hospital closures in rural areas, the access in rural areas, and making sure that people understand that it's not just that particular demographic, that it's rural, and it's also, you know, children. And if there's one thing that we can unify around, it should be our children. And that all children, you know, that don't have that access need to be able to have better access and expanded services. So I think that those are some of the strategies that we're seeing, that we're trying to push those people that have not traditionally wanted to vote for expanded social services.
Well, you raise an important point, which is this really isn't a partisan issue. This is a health issue. This isn't an urban rural issue. This is a health issue, and it's an access issue. And so we have just a few minutes. So I'm gonna allow each of you an opportunity to just offer some closing thoughts. But I did want to share, just for those that are joining us today that may not be as deep into Missouri's politics and happening as all of us are, you know, during the last election, we saw a really interesting phenomenon amongst Missouri voters, which is that they would vote for very conservative elected officials, yet they would also vote for very progressive kind of policy changes. And we saw, when it came to a referendum, we saw that the voters voted to repeal a right to work. We saw the voters approve a medicinal marijuana bill. We saw the voters approve Clean Missouri, which is a kind of campaign and redistricting reform. We saw the voters of Missouri vote to increase a minimum wage, which was going in a direct opposition of what many in the state legislature wanted. So you know, in your comments, I'd love to see how, I mean, we don't want to be overconfident because that's how elections are lost. And this is a really important issue when we want people to mobilize. But I'm actually feeling particularly optimistic because the voters have, and the voters in Missouri have demonstrated that they understand these types of policy issues, and they understand how they can improve the state. So with that, I'd like to offer each of you an opportunity to just offer some closing remarks, and then Cynthia will wrap us up.
I'll start.
Yeah.
Go ahead,
Go
Brian.
ahead, Laura.
Okay. I would just like to just focus on not underestimating the voters of Missouri. This movement to build around Medicaid expansion is really mobilized at the local level with experiences and intimately connecting with individuals and the local leaders. And there is tremendous support, but there's also just momentum for what COVID has allowed for of equaling the experiences where everyone is impacted, and how vitally important healthcare is to everyone. And I think that puts us in a better position to be able to support something like Medicaid expansion. So I'm optimistic as well, but this is the show me state, right? You all still have to get out to vote.
I agree with Laura. I think that's the most important thing, is getting people to vote. If we can get, you know, traditionally, our voter turnout is pretty low, but this is a pretty exciting election. There's a lot of things on the ballot, and I'm hopeful that we can get a lot of people out to vote and that understand this issue, and yes, see it as a healthcare issue. Yeah, this is about healthcare and access, and that we can get them there and they can vote yes.
Yeah, absolutely. I think it's a healthcare issue, a health access issue. It's a family issue. It's a children's issue, and really, it's something that is going to help our children, families, and communities be stronger. So I really think that it's really critical that we all get out to vote on August 4th, and that you know, that Missouri becomes the 39th state to implement Medicaid expansion.
I just support everything that was said, and I would just end it with saying it's a basic needs issue, and we have an opportunity to change that for Missourians. And I think in Missouri sometimes, well, no, we know that we're often not the first, as has been the case with Medicaid expansion. And I would just urge everyone to get out there and vote, and to pay attention to the data and the research from the other states. We're not trying something new here. It's been done, we know it works, and so why wouldn't we do this for our children and our families?
Absolutely. Thank you to our panel. Thank you for your thoughtfulness and for sharing your expertise and knowledge with us this afternoon. And I just like to say to our audience, let's do our part. Let's reach out to 20 people. I am bombarding my contacts and texting to them and telling them vote. And I am saying vote yes on Amendment 2. So again, thank you. Thank you, Garrett. Always a pleasure, my friend. And so we'll let you go. We're right on the hour. And we appreciate you all very, very much.
Thank you, panelists.
For having us.
Thank you.
Bye, everyone.
Thank you.